This is a conversation we've actually been having for a while, but when it comes to those family doctors, sort of that critical first person that you're going to be seeing, what are your thoughts here? Because what Chanel was saying and the list of items, this is not new, but it's something that, those issues continue to grow.
Yeah, and I think they became accelerated during the pandemic for physicians who worked under a fee for payment model. So in other words, I see you, I bill to see you. They were advised to stop seeing patients, but their overhead went on, their costs went on, the expenses of PPE went up, and simply many physicians could not make ends meet. And I know of groups that actually closed their doors because they could not afford to stay in business. We've got a lot of physicians in their sixth decade who just burnt out, said, this is not what I signed on for. They're pretty exhausted. They don't want to sign on another lease, and they're walking away earlier than anticipated. We also don't have enough trainees going into family medicine. So if the weight and balance doesn't work in terms of inflow and the outflow, we really are sitting at a crisis. And although you talk about this group and how they've been affected, there's about 1.8 million Ontarians who don't have a family doctor at all.
Yeah, exactly. And family medicine, why is that a difficult, I guess, field to fill, to have the abundance there for medical students to say, yes, this is what I want to be doing in my career?
It's a tough career. I mean,
Yeah.
I'm a family doctor. We pretty much do it all. And the last 2 years have been very, very difficult with the backlogs in the medical system. It always seems that you're trying to get something for a patient that just has too long a wait period. So it isn't 9 to 5. It isn't 7 to 9 at night. It just seems to be endless where, we're really fighting an uphill battle. And in many ways, primary care is the gatekeeper to the medical system. This is where patients enter. We try to do as much as we can before we refer, but the entire system has to be integrated for it to be able to work properly.
More support, better pay, of course, and of course, lots of lessons learned, sadly, during this pandemic. Are we seeing movement on the government side? Are you feeling that you're seeing some shift in the right direction? It seems like it's still a constant fight.
I think it's still an ongoing battle. I mean, you look at what happened in the Maritimes and what's happening with their physician crisis now in the province of Ontario, which is more of a have than a have-not province, if you will. This is really a Canadian crisis, I think, and it really is time for us to be addressing it far more aggressively than we have in the past. I think everybody is doing their best, but with exiting physicians and them leaving earlier than anticipated, it puts even a greater burden on the system.
And we are not out of this pandemic, and people are continuing to get sick, whether it's COVID or something else, and doctors are so desperately needed. Dr. Marla Shapiro, we appreciate you. Thank you so much for giving us your time, CTV's medical contributor.